Community services have a really important role to play in maintaining and improving the health and well-being of the people, families and communities that we serve. I see an expanded role for our services in the future, working closely with all the other organisations. How we go about the changes will be the subject of discussion when I and my colleagues come out to visit you in the localities and talk about the plans for the future, your role in them and how we take them forward together. We're facing a really difficult period in the NHS and we need to change a number of aspects of the way we work. The imperative for us to do that is really clear. And I want to talk first about some of the areas that are influencing why we need to change. Firstly, about the population that we provide a service to. Secondly, about long-term conditions. Then about the financial position of the NHS, the policy framework we operate within, and the information revolution that's happening around us. The changes in our population are happening quite quickly at both ends of the age spectrum. We're seeing increases in the number of children in Hertfordshire and increases in the number of older people. In the years between 2012 and 2037, the number of people over 65 in Hertfordshire will increase by 70%. We're also reaching a tipping point where the number of carers available will be outstripped by the number of people who need care in Hertfordshire by next year. With regard to long-term conditions, we spend 7 of every £10 in health and social care on people with long-term conditions, and we're seeing a rising tide of demand coming through. In 2015, the number of people with long-term conditions are using half of all GP appointments, nearly 2/3 of all outpatient appointments, and 7 out of every 10 inpatient stays are for people with long-term conditions. By 2018, the number of people with 3 or more long-term conditions in the UK will rise to 2.9 million, and they're people who need more service provision. By 2026, we expect to see around 1 million people with dementia, with estimated care costs of £35 billion. And by 2030, the number of people with diabetes will have doubled from its current level, from 2.5 million across the country to 5 million. As we spend 10% of the NHS budget on those people, that's a massive increase in demand, driven by issues of weight and obesity, and we need to tackle those issues before we hit that level of demand. The finances of the NHS are very tight, as everyone will know. Against that rising tide of demand, we're receiving around a 1% increase every year, and that's the case between 2010 and 2020. In the years prior to that in the NHS, we received an average uplift of 4%. So you can see that we're being asked to do more with about the same amount of money. The national policy, the 5-year forward view, which was published in 2014, makes it clear how we should address those challenges that we face. It requires us to close the gap in people's experience of health, to close the gap in quality of services, and to close the gap in finances by becoming more efficient. It also talks about people and communities becoming more involved and more active in their own health and well-being. In terms of technology, we're living in the middle of an information revolution, and we really need to use that in the best way that we can to support good clinical and management decisions, and to use communication technology to change the way we work with people who need our services. I find it helpful to think of the population in 3 sections. So 10% of the people have complex set of needs. Those might be people with 3 or more long-term conditions, severe mental health problems, or children with severe disabilities, people that we work with regularly in the Trust. There's a further 20% of people in the population who have long-term conditions, and then 70% of the population who are generally well and use the NHS for specific episodes of care. And we have a different job to do with each of these groups. For people with more complex needs, they tell us that the individual services are good, but actually we don't join them up. What we need to do for them is coordinate their care very carefully, listen to what they want and deliver a very personalised service. So we focus on the outcomes that are important to them, improve their experience of services and reduce the cost of our interventions by doing a better job together. For people with 2 or more long-term conditions, the next 20% of the population, we need to focus on them becoming self-managing. This will reduce demand on our services, which is really important for us. And the evidence, importantly, is very good that when people take responsibility for their own health and well-being, they do far better. For the healthy population, we need to focus on a number of areas, particularly as people age. It's really important that they maintain their social networks as they age. It's important that they remain active. And there's also good evidence that continuing to learn is really beneficial for people in older age. We need to see our older population as a resource. Same is true for children. We need to support children and families to start life well, to develop well, tackle issues like obesity, support good mental health and physical well-being, physical health and well-being as well. Actually, it builds on much of what we do already, focusing on the health and well-being of children and families, supporting people with long-term conditions, and organising care and support around people who need it, working with other organisations like general practice, mental health services, social care, voluntary and community organisations and families themselves. And we do that in our services already. We do that in Home First and we do that in Rapid Response. Our organisation is fundamental to the changes that are going to take place, and you need to play a big part in that. I know how committed you are to doing the very best job that you can for people, and I want to draw on that. And the most important thing I and my colleagues can do at the moment is unlock your imagination, commitment and skills to delivering the changes that we need to see in health and social care. And I want to have that conversation with you and your colleagues about how we do that. I look forward to seeing you.